Welcome back, Governor County. Joined this morning with Dr. Kinzer. Good morning.
Morning.
Jackson Creek Dental Group in the house.
Yes,
we are.
Betcha. And I want to ask you about appliances, because a lot of people just think, oh, they can go get an appliance, put it in the hot water, put it in your mouth, and that's not true.
It's not true. You know, it's certainly better than nothing. In some cases, it may be like nothing. When you look at sports injury, football, for instance, is required to wear appliances, and that when we look at injuries, less than 1% of injuries that occur in football have to do with the mouth. When you look at basketball, which doesn't require appliances, you'll see 30 to 50% of the injuries that occur in basketball occur in the mouth. So that's telling you right away that, you know, appliances are needed, protective appliances,
Right.
especially in sports that it's even not required. So we need to look at those possibilities. Then next is, you know, look at what can you use, what different appliances are out there. You've got over-the-counter appliances. Then you've got appliances that dentists can construct for you. You know, we start off with, this is just a simple stock appliance that attaches to a football mask. This is probably the least protective, least expensive. You'll spend anywhere from, say, $1 up to, say, $5 and $10 for something like this. And as you can look, it fits loose, and you just put it in the mouth. What holds it in the mouth is your pressure. So if you get hit or open your mouth, it's going to fall out.
Okay.
Then we've got boil and bites, which is probably the most common ones that you'll see used. This is something you'll put in warm water, and then you put it in your mouth, and the patient or person will form it themselves. The concern with this is that it's fit, certainly. What I don't like about this is that what the patient will do is they'll bite down in it, and as you bite down, it really thins down in the back. And what we're seeing is that many injuries, not just the front teeth being knocked out, but many injuries occur from the jaws being hit and hitting together. And you not only do you damage the back teeth, but you also cause concussions that way.
Oh, really? Wow.
So then our dental appliances, we use like vacuum machines or pressure lamination. The big one here is we construct these off of appliances or off of an impression. Okay, and this impression is an accurate impression of the patient's mouth. We make a cast, and then we heat up these types of materials and vacuum or pressure that over the top of the teeth, certainly getting a much better fit. You know, and staying in better during the trauma time.
And you can do them in your team colors and whatever.
Team colors, yeah. We got the school colors.
There you go. There you go.
Use a lot of the green and the blue.
And it's really important to really protect your teeth.
Definitely.
Because, man,
yeah, trauma's bad.
it's really, really bad. And then you can also, not wearing an appliance, you can also knock your jaw out of whack, am I right?
You can cause jaw trauma. You know, like in wrestling, you'll see it's a combined upper and lower appliance typically, because there's more chances of jaw trauma. You know, the biggest thing we're preventing with this is we're attempting not to knock teeth out. Because when you look at some of the statistics, one tooth being knocked out as a child, you're going to spend anywhere from $10,000 to $15,000 in a lifetime of that person replacing that tooth either with implants, bridges, and things like that. So it's a very costly mistake to not wear maybe, say, a $50, you know, the dentist can construct these for as little as $50, you know, certainly less expensive for the store systems. But
But if your child plays sports, it's very important to get to have a dentist.
Yes.
To do that for. Now, and they last for quite a while, right?
You know, the jaw's going to be growing, right? Teeth are going to be erupting, so usually each season you're going to need to replace it for a child. You know, an adult, it's going to last for, you know, 4 or 5 years, 6 years, you know, depending on how much they're wearing it, for sure.
Now, every mother out there is probably asking the same old question right now, is that what's the first thing you do when your kid gets a tooth knocked out?
So you got the tooth, and it's in your hand or it's on the ground. Certainly find the tooth. Even pieces of tooth you can find. But if you find the tooth, don't touch it by the root. You know, pick it up by the crown. The crown's what's in your mouth. It could be kind of bloody. You know, usually it's not, because the blood's going to be more in the mouth. And you pick it up by the crown. Don't touch the root, and then place it in milk if you have milk available. If milk's not available, we recommend to actually put it in the patient's mouth in the cheek. Don't choke on it. But you place it in what we call the vestibule. So it would be kind of just at the outside. And the idea is to keep it moist. Dryness is the worst thing you can do for a tooth. Letting it dry out is going to cause more damage and the less ability. Also, the other key is time. If that tooth can be implanted within 5 minutes, even at the filled, which sounds scary, you know, like I'm going to put this tooth back in you want to put it in the right way. I've had parents had no dental experience in a remote area. They've reimplanted teeth, and you know, you're traumatized, you're hurting, you're bleeding. A lot of times in the office, I may not even get the patient
So
to
you,
reimplant the tooth.
you don't encourage somebody like Cam and I to take some super glue and stay.
Maybe not. Maybe
Oh,
not.
okay.
But, hey.
Good thought, though, huh? Yeah.
Let's tell the viewers where Jackson Creek Dental Group is located.
We are located in Jackson at 100 French Bar Road. Our phone number is 209-223-2712.
And it's very important, if your child is going to be playing any sport, it is important. Get down there and have a mouth guard made for them, because you know what? This dollar one's not getting it.
No, not going
And
to
especially permanent teeth. Now, baby teeth, if you lose those, it's best just to let them stay out, right?
Do not. Baby tooth comes out, leave it out, because there's more chance of causing trauma in the site and hurting the permanent tooth that's developed underneath it. So
Right.
leave the baby teeth out.
So basically, when you put a tooth back in that's been knocked out like that, and it has a little of the root, it will actually reconnect itself, or?
It does. We a lot of times will split the tooth in, so we use orthodontic appliances or wires and glue them together for a period of up to 8 weeks. And after that period of time, the bone just reattaches. The nerve will even reattach sometimes too,
Good.
and not need to be root canaled.
A little bit of dental school this morning.
Yeah.
All right. Hey, we're going to run to an ad break. We'll be back with the closing of Friday's AM Live. Stay tuned.